Hi class and Dr. Glass. After watching the video on Tony, you can clearly see that he's portraying symptoms of dissociative identity disorder. And he's even really aware of what goes on in his head and what's happening with all the identities that he's dealing with. I found that really interesting. He even explains that each identity has different voices, different sounds, and none of them are really the same. He said that some days he just wants to be normal Tony, but he has no control over it, and I think that was really sad to listen to. I can't imagine how stressful that can be. But I think a very helpful part of the video was when they showed the therapy session with Tony, and how they were actually able to capture the transitions from identity to identity. And it seems like he went through about 2, maybe 3. I believe one of them was Richard, and then he had a little bit of Anthony that came out, the little boy. And it was clearly evident that, and kind of predictable when he was about to make the transition, like when he started rubbing his face or he was really fidgety, and just kind of moving around a lot. And the part where the little boy came out, the therapist knew right away what was happening and she addressed it immediately. And just watching that therapy session, you can just really see the anxiety that he deals with this disorder. And he even explained a situation where he went to a wedding and he didn't even remember that he was there or what happened, and he had to ask some of his friends, what was going on. But from my perspective, I think, yes, it was really sad watching just kind of how the disorder was unraveled and hearing it from, directly from a person who struggles with it and just their perspective about it. And you can clearly see how difficult it can be, especially for Tony, being that he had 53 different identities, which is a lot according to the text. I think it's usually 15 or somewhere around there. As far as a Christian perspective, I think it's really difficult to address this disorder just because of the severity of it. I think it can be a little difficult to pour into someone's life due to the constant unawareness of different identities, or just learning how to deal with each of them since there are so many. And I think as clinicians, we just need to be deeply educated on cases like these and know how to give them the best support and the best treatment plan. But yeah, thank you.